You're listening to OET Roleplay Practice with Kev, the English native.
Hello, it's Kevin here. Welcome back for another nursing roleplay episode. So this is nursing roleplay number 6, yeah? So, as I said, I'm going to try and do one for medicine and one for nursing every week, if possible. Just taking me a fair bit of time because I have to get AI to write me a script. I've got to rewrite it at least once to make sure that all the tasks are appropriately addressed. And I've got to map it to criteria and so on and so forth. And I've got to turn it from text into speech. I've got to sort the voices out, etc. And, you know, do the transcript and all this other stuff. So that just takes a bit of time. And of course, I've got my YouTube channel, which I'm working on as well. So I've got my general English podcast, the English native.com, and I've got this OET one and YouTube. And then of course there's my academic articles that you can find on LinkedIn. Links below if you're interested. Anyway, so this role play, it's a pre-operation consultation, right? So it's between a nurse, patient, early 60s, and he's scheduled for an operation, and he's coming for a consultation. The nurse is going to do whatever she's got to do some tests and explain how things are going to work out. He's not particularly anxious like such, but the nurse does have quite a lot of information to give him. So if you have a listen, read the script, and there'll be a link for that below. You can see the kind of phrases that she uses, all mapped to the criteria, of course. So, as I said before, you can use this in two ways. You can use it to model pronunciation. If yours does need some attention, you can shadow and copy, pause, repeat, etc. You know how shadowing works. And the next thing you can do is you can read the transcript and see how the criteria, the clinical communication skills, A, B, C, D, E, see how they're mapped out to the phrases. You can see what phrases you can use. And I'm going to try and make that video that I've spoken about today. I'm going to try and do it this afternoon. So there'll be a video. I might make an episode or put a link to it once it's done, where I'm going to go through the process of how to use the audio, how to use Grok to act as your speaking partner for the role play. Anyway, just have a listen to this and I'll be back afterwards.
Good morning, I'm Evelyn, one of the pre-operative assessment nurses here at the community hospital. Thanks for coming in today. So before we get started, can you confirm your name and tell me how you want me to address you?
Morning, nurse. I'm Kevin Dean, so just call me Kevin.
Thanks for that, Kevin. So to confirm, you're here for the pre-operative assessment before your hip replacement next month. Is that right?
Yes, that's right.
Thank you. Before we begin, do you have any questions or worries you'd like to raise so I can make sure we cover them?
The consultant did explain I needed a pre-op assessment when I saw him last time, but I'm still not exactly clear on what it means. I understand the medical parts, but I don't really see how I can prepare for the operation.
That's completely understandable. I'll walk you through the whole process and the preparation step by step, and we'll keep it practical. By the end, you'll know exactly what happens today, what to do at home, and what to expect before and after surgery.
Okay, that would help.
Great. So first, we'll complete a health questionnaire to review your medical history and current medications, record your height and weight, do some routine blood tests, do an MRSA swab to check for bacteria on the skin, and I'll give you clear preparation advice for the weeks before surgery. How does that sound?
That's clear enough, but I'm still not sure what I can do exactly to prepare.
Good question. Let me explain. There are two main parts, pre-operative exercises and discharge planning. Let's start with the exercises. Aim to maintain gentle mobility around the hip, short, regular walks if comfortable. Do simple strengthening work for the muscles supporting your hip, glutes, quads, and core. Pay attention to posture and your walking pattern. Smooth steps, avoid jerky movements. These will help support the new joint and make recovery smoother. Do you think you will be able to manage that, Kevin?
I think I can try those.
Excellent. I'll give you an information booklet with diagrams so there's no guesswork. Now, discharge planning. This is about making home safer and easier after surgery, such as clearing trip hazards, arranging items within easy reach, what assistance you might need for the first couple of weeks, family visits, a friend or a neighbour to help with shopping or meals. Also, planning transport to and from the hospital and, if needed, help getting into your home safely. That's quite a lot of information, I know, but before we go on, is there anything specific you want to know about?
Actually, yes, I've read some worrying things online. Hips not fitting, infections, DVTS. I'm quite concerned.
It's perfectly natural to feel anxious when you read mixed reports online. Here's what you should know. Hip replacement is a common operation carried out by skilled surgical teams. The artificial joint is pre-measured and adjusted during surgery to ensure an exact fit for you. We take strict measures to minimise risks, sterile technique, antibiotics where indicated, and early mobilisation to reduce DVT risk. Okay so far, Kevin?
Yes, I get it.
As well as that, the doctor will go through possible risks in detail on the day of surgery, and you'll have time to ask questions before signing the consent form. Meanwhile, we'll focus on what you can control: pre-op exercises, home setup, and following your medication and fasting instructions.
That helps. I also heard I'll stay in the hospital for 3 to 5 days, but sometimes it's longer. I want to go home as soon as I can.
Of course, and we will do everything we can to help you. However, discharge depends on a few factors: recovery from the anaesthetic, your mobility and reduction in pain to a manageable level. You'll have guidance from the consultant and physiotherapist on hip care and when to return to normal activities. We'll arrange follow-up appointments and practical advice so you're not left guessing.
I see, but how will I know if the operation has been a success?
The outcome is confirmed by the doctor based on your recovery milestones, pain levels, hip function, and imaging if needed. In simple terms, success looks like improved function, reduced pain, and safe mobility that keeps getting better week by week. We'll check in with you regularly to track that progress.
Okay, that makes sense.
Good. Before we proceed with the assessment, let me quickly summarise what we'll do today, just to keep things clear. First, health questionnaire to capture your medical history and current meds. Then height and weight, routine blood tests, MRSA, swab. After that, some practical preparation advice, exercises and home setup with a booklet you can take home, okay? And we'll address any further concerns you have as we go.
That sounds good, nurse. I appreciate the clarity.
Do you have any other worries or questions about the operation, the team, or recovery?
No, I think you've covered everything. Thanks.
Perfect. The doctor will go deeper into surgical details and risks on the day, and you'll sign a consent form once everything is clear. For now, if you're happy to proceed, we can start the pre-operative assessment.
Yes, I'm ready for it to go ahead.
Excellent. Let's begin. I'll talk you through each step as we go, and if anything feels unclear, just say, and I'll explain it again.
So, there you go. I hope you found that useful, informative. Now, don't forget our links below, as I said. Feel free to write to me, contact me anytime. if you want personal lessons, if you just do a Google search for Kevin A. Dean, native English teacher, or Kevin A. Dean italki, because that's where you'll find me on italki, or you'll find me on LinkedIn and on Facebook as well, if you wish. Anyway, however you want to contact me, feel free to do so. And if you need any help with speaking or writing as well, don't forget my YouTube channel has many videos for OET letter corrections. So that's a service I offer also. So there's a lot of letter correction videos on YouTube, and this, if you're listening to it now on Spotify, is a fairly recent venture for OET speaking. Anyway, regardless, if you need any help, feel free, get in touch anytime, and check back. There should be a new episode a week. And if you have any requests for episodes, feel free to contact me and I'll see what I can do. Whether you're a doctor, a nurse, a veterinarian, a pharmacist, etc. If you need something particular, let me know and I'll see what I can do. Okay, that's all for now. Happy listening, and I'll see you next time.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.